Yeah, I haven't watched it yet. She said it's hilarious, where it's like a Zoom meeting, but people in a conference room. Like what it would look like if like people were actually.
Were there?
You know, where two people are like, no wait.
And then I had, or we're not. Yeah, you called the other day. I said, "Oh, during the stress out."
Oh, I do that on purpose. Yeah.
Cute. Alright.
We're coming back to this side.
Well, because Al's here today, and you
So-
weren't here, like, there was always one short.
No, you were staying
Yeah.
over there with Al.
Yeah.
When, or the, you've been over there, it's fine.
Okay.
And then
I'm not gonna be over there.
No.
That's it.
No, you told Because I had been sitting, remember?
That's-
I had
oh,
been
yeah,
sitting.
yeah. Oh, stop.
Yeah.
I do prefer that side, I don't know.
I don't know what she.
Do you?
Because.
Yeah.
That's the thing.
I'm deaf on this, like, you know, I can hear about, you know.
So go ahead.
outside.
But I understand it's user. We have.
I didn't want to start anything.
Yeah, I said, I felt it, Joe, you were a witness.
What do you decide is better?
Well, the other thing.
So am I
we do
on here
is,
now?
like,
I mean, no. Okay, so it doesn't even.
You can.
Oh, no, you are actually. When you're over there, you are. Yeah.
Or somehow record it, and then I can drop it.
Well, I see you guys can sit here, I can quote you.
I know.
No, it's recorded. Unless it was.
At least you raise it for me though. And the guy who came first, he wanted it, like my head was never. My head was never.
No,
Right around 4:05.
I try to do a little lower, but I can't.
And we can, ideally, she's just on Hugo with him and they talk and he records about his end
And
and
you're
stuff.
in the middle.
Yeah, and I don't have to be there. If somebody uses Hugo, then I can stay.
Joe, for a second, I was like,
He can record it.
I just was standing in
I
the.
can
Joe,
record it.
I was like,
I said
I'm
that.
like,
Joe's officially almost.
I think the last time I was here, I interpreted
So
so I was
if you go
watching.
here,
It took
someone else-
a good 5 minutes before I realized I was doing it.
Right, yeah, if somebody's going live.
I see.
We have two, so there's one for air and then there's one for backups for stuff like this. But right now, traffic is usually the backup. Because they're all, they're up in the studio.
That's
So.
because we're gonna have Sarah,
So-
all right.
Normally.
I'm leaving him, he smells.
Turn the mic back on.
Besides,
You
during the
clash
queue,
with,
I can do what?
you clash with my blue. I said, I'm joking, joking.
This way I can go like this, or like. I don't want to be disrespectful to Miss Val.
They're like, let's have it.
We're punchy, it's Friday.
So I got nothing, nothing at all.
The weeks are
Yeah, today was.
all good.
Yeah, today was.
Dr. Wong.
Yeah, the Chester County Prison Guard.
All right.
Yeah,
No, Chester's helping me.
Yeah,
All right.
yeah.
So I'll put up the mic on.
Right. It's just, it's not like Delco's a small
Yeah,
town.
but
Just the,
walking in.
I didn't think,
All
I
right.
didn't think anyone expected this.
Right.
So I think out of the gate, she's like, sure. She and I are both on her build out apartment committee, that are
Right.
helping them figure out how to do it.
Yeah.
And mine is a big one, and she's like, "Hey, after, and I'm like, hey, good job. Good, but they wouldn't ask me.
6 weeks.
I would.
Took 6
But
weeks to
it-
get in a chair.
Yeah.
I wasn't
I'm
the chair.
sure now she's like,
I wasn't the chair.
6 weeks.
But I started in the chair.
That's true. You start over there in a chair.
we got a raise, so.
Alright, tell me where.
Go like this.
That'll be cute.
We have a huge
On week 12.
viewfinder now.
Let's hear
So.
it, you want it?
I see, right, week 12 or something, week 15.
Good.
How are you?
Am I in? Okay, then I'll just say.
You good? Good? Okay, great. All right. Good afternoon, everybody. It is Friday, April the 17th. This is the end of our 6th week. We got our first 2 positive cases here in Montgomery County. What will be, I guess, 7 weeks ago tomorrow, or the beginning of the 7th week tomorrow. So here we are. And since yesterday, we have received notice of 111 new positive cases of COVID-19 in Montgomery County, bringing us to a total of 2,423 These positive individuals are from 32 municipalities, none of which are reporting new cases. This keeps us at 61 of our 62 municipalities that are home to individuals with COVID-19. Today's individuals range in age from 5 years old to 99 years old. As always, you can check our county map at www.montco.org/COVID-19 to see the geographic locations. The age brackets today, we have 3 children between the ages of 0 and 9, 1 between 10 and 19, 3 individuals between 20 and 29, 8 between 30 and 39, 10 between 40 and 49, 18 between 50 and 59, 17 between 60 and 69, 21 between 70 and 79, 23 between 80 and 89, and 7 between 90 and 99. We have 62 females, 49 males. 10 are known to be hospitalized, 5 are known to be at home in isolation, and 96 we don't have information on. I'm saddened to confirm that 7 more Montgomery County residents have lost their lives to COVID-19, which brings us to a total of 135 deaths. 4 of these individuals were in the hospital at the time of their passing. 1 was in their residence, and 2 is not known. They ranged in age from 64 years old to 98 years old. Overall, 62 female residents and 73 male residents have passed away. The racial breakdown for the individuals who have passed away: 9 Asian, 2 Asian Indian, 2 Asian Korean, 15 African American or Black, 57 white, 50 that are unknown. Our hospital beds continue to be in stable condition, thanks to all of you staying home. We have beds available in all of our hospitals, both in the regular units and in the intensive care units. We also have ventilators that are available. And as a reminder, we do have our surge hospital capacity at Suburban Hospital, but thankfully we have not needed to use that extra capacity. Today's long-term care facility update, we continue to have 79 facilities that are reporting positive cases of COVID-19 among their staff and residents. Today we have 44 facilities with 1 to 5 cases, facilities with 6 to 10, 6 facilities with 11 to 15 cases, 2 facilities with 16 to 20 cases, 1 facility with 26 to 30 cases, 5 facilities with 31 to 35 cases, 3 facilities with 36 to 40 cases, 5 facilities with 41 to 45 cases, 1 facility with 56 to 60, and 1 facility with 71 to 75 cases. In total, we have 607 cases among residents and 323 among staff. Do want to remind everybody that all of those people are not Montgomery County residents. Particularly among staff, they could live anywhere in our region, and it is also true for the case of the residents that a number of them have a permanent address in a different county. But we do and are tracking these cases collectively to help the community understand some of the challenges that are currently being faced in our long-term care and other congregate facilities. So as of today, we do have 91 deaths of Montgomery County residents who were affiliated with a long-term care facility. So this brings us to 67% of our total deaths here in Montgomery County. We continue with our daily outreach, phone calls, and other communication. We have continued to try to prioritize these locations with the State Department of Health and ECRI, the organization that's assisting the State Department of Health. Next week, we hope to be visiting on site with 2 of our staff some of these facilities, assuming that they would welcome our help and our assistance. It is part to have us come in, but we would love to be able to do that to see if we can offer any assistance. And as we have been reporting, we are beginning to get up and running with our real-time medical systems monitoring. We have, I think at this point, 9 or 10 facilities that are beginning to share data. Don't really have anything specific to report from that data yet. Hopefully by next week, get that data organized and get it in a form that we think will be most helpful. We may be able to comment on that to some degree. Today, from our Montgomery County Correctional Facility, we learned of an additional inmate that has tested positive for COVID-19. This brings the correctional facility to 3 inmates that have tested positive for COVID-19 and 4 individuals from are awaiting test results. Happily, all of these individuals are in isolation and currently stable. No one has required hospitalization. The cellmates of these individuals are currently asymptomatic and also in quarantine. As a result of potential exposure, 218 individuals in total are in quarantine and all are asymptomatic. Our community-based testing site is open and running smoothly. The appointments for Saturday, tomorrow, will open at 8 a.m. tomorrow morning, and the appointments for Sunday will open at 8 a.m. Sunday morning. You can make an appointment at montcopa.org/COVID-19 by clicking on the green County Testing Information button, or by calling 610-631-3000. And again, I just want to quickly highlight 2 changes at this site. Well, 3. First, it's at the Montgomery County Community College. Second, this site is using self-swabs, which means that you will take the sample from your nose yourself. There is a video showing you how to do this very simple process under that same green County Testing Information button on our hub website. If you click on what to expect, you can see a short video that shows this process and shows how simple it is. And as I have mentioned, it is less uncomfortable than the process that was being carried out previously. So you should find it quite easy. Also, we've started a waiting list. So if you, all the slots are filled for the day. When you go online or if you make a phone call, you'll be offered the opportunity to go on the waiting list. If you don't get called, for instance, if you're on tomorrow's waiting list and you don't get called tomorrow, that list erases at the end of the day. So you need to come back Monday morning and try again to make an appointment. We do have 250 appointments a day. Our goal is to use every single one of those tests. We have a guaranteed contract that a commercial lab will run 250 tests from Montgomery County every day that we send them, and so we want to make sure that we use every one of those tests. I do want to just mention that we still are in need of surgical masks and impervious gowns. So if any business out there finds a box in their closet, we would be grateful to get it, of either of those items, surgical masks or impervious gowns. And if you do have those items and you might be able to donate them, please email us at covid19@montcopa.org. That's covid19@montcopa.org. So a couple comments about social distancing, masks, and some other things. So recently I've gotten a comments, I'll say, along the lines that only residents of long-term care facilities are the ones that are really getting sick and being hospitalized and passing away from COVID-19. And I just want to remind you that 33% of the individuals who have lost their lives to COVID-19 from Montgomery County are not residents or have any connection to long-term care facilities. In fact, one individual was in their late 40s. Positive cases in Montgomery County have ranged in age from 1 month to 110 years old, but the average age of positive individuals is only 54. I also want to remind you that we, by staying home, protect our healthcare workers who are already at enormous risk. So far, today the CDC released some new information that to date, 9,282 healthcare workers in the United States have tested positive for COVID-19. And their median age is only 42. And some of these workers have died. So this isn't someone else's problem. This is every one of our problems. And we are all in this together. And we all need to do our best to stay home, to minimize our trips. If we pull into the grocery store parking lot and that parking lot is packed, please leave and go to a store that looks less crowded or come back later. These steps are critically important because people can be contagious and not have symptoms. And by going into a crowded location, you have no idea whom you might be infecting. So please be careful. And please remember that it takes our entire community working together to achieve what we've already achieved, which is a hospital system that's currently stable, which is a hospital bed that will be there if you fall and break your leg, if you have a heart attack, if you have COVID-19. This is the critical thing that we have to still keep in mind. I know how tired you are of this, but this is not the time. We are not there yet. I also want to mention that Governor Wolf has signed an order that goes into effect at 8 p.m. Sunday night that puts into place a number of requirements for businesses, essential businesses, and one of those requirements is that there's an expectation that masks will be worn by employees and patrons of those businesses with some small number of exceptions. So I just wanted to review some information about masks. First of all, cloth masks provide modest protection. Wearing a mask does not make you a superhero. Wearing a mask does not make you invincible. Wearing a mask helps to protect other people if you are one of those individuals who's contagious and doesn't know it. And wearing a mask gives you modest protection if somebody else who's contagious and doesn't know it happens to end up close to you for 10 minutes or so. When you are handling your mask, it's very important to remember that the front of the mask should be treated as if it's contaminated. So, listen, I wore masks in the OR my whole life. All you want to do is grab it from the front and take it off. But we cannot do that, touching your face. What you want to do is grab it from either the ear loops or if it's got ties, untie the ties and pull it off back to front. Try to resist touching it from the front and pulling it off that way. Because if it's contaminated, then you've contaminated your hand. Once it's off, you want to be mindful of where you set it down. Don't set it down on your kitchen counter or the place where you prepare your food. Don't set it on your kitchen table. Bag where it's not going to touch anything else. And then, as soon as you can, you should wash it in hot water with soap and leave it out to air dry. Doesn't have to be in a washing machine. It can be in your sink. It can be with dish soap. Doesn't matter what kind of soap. But it just needs to be washed and then laid out to dry completely. So, on how to safely wear a mask. Oh, and the final one is how you actually wear it. So the mask is meant to cover your nose and your mouth. I see people all the time walking around with their nose uncovered and only their mouth covered by the mask. I know why you're doing that. It's easier to breathe that way. I get it. I wore masks all day, every day for years. However, you have to cover the nose and the mouth or the mask is doing absolutely no good for protection for you or to protect somebody else. All right? And with that, I will turn over to Commissioner Lawrence. Oh, and I forgot to mention that I'm here with Commissioner Lawrence and Commissioner Gale and Dr. Brenda Weiss from our Office of Public Health and Dr. Al Wong, our Regional EMS Director.
I'd like to share some disturbing information on behalf of our District Attorney's Office. They have done an analysis of domestic violence calls and incidents in Montgomery County during the COVID-19 crisis, and an analysis of these 911 calls and filed police reports have revealed that since March 11th, when restrictions started being imposed, domestic violence incidents have increased by 8 to 9% here in Montgomery County. And sadly, there were 2 murders just this week, both related to domestic violence incidents. So despite this alarming news, we want people to know that our need to stay at home and implement social distancing efforts during the COVID-19 crisis doesn't mean that you have to tolerate abuse. Our police are still responding to calls for assistance with domestic violence and other crimes. The courts are still handling PFA orders through the emergency court. The Prothonotary's office is still open, and there have been more than 50 PFAs issued since the crisis began. And there are many resources for domestic violence victims that are available and continue to operate during the crisis. So I want to share a few of them. One, Laurel House provides on-scene response, crisis counseling, safety planning, resources referrals, PFA assistance, sheltering, and advocacy. And their domestic violence hotline is 1-800-642-3150. That's 1-800-642-3150. And their website is www.laurelhouse.org. And they're using telehealth via phone, text, and video conferencing. The Women's Center of Montgomery County also provides similar crisis services and relocation assistance. Their hotline is 1-800-773-2424, 800-773-2424, and their website is www.wcmontco.org. Both these hotlines are answered by trained volunteers who can listen, offer advice on services, provide safety planning, and get immediate safe shelter for victims and their children. Both agencies also obtain PFAs through the courts, and there's additional services for victims of violent crime. The Victim Services Center, which supports victims through crisis counseling, medical exam support, assistance with protection orders, referrals, PFAs, and advocacy. Their hotline is 888-521-0983, 888-521-0983, and their website is www.victimservicescenter.org. And they are also using telehealth via phone, text, and video conferencing. And finally, Mission Kids Child Advocacy Center. They provide crisis and justice system support, advocacy, referrals, mental health treatment, medical care, and other follow-up services. They can be reached at 484-687-2990, 484-687-2990, and their website is www.missionkidscac.org. And as disturbing as these numbers are, it's likely that there are many calls that are not being made. So we want to emphasize again that police are responding to incidents, the district attorney is prosecuting, and the courts are still open. And sadly, child abuse calls are down. And as it was explained to me, that's because our children aren't necessarily teachers and daycare providers and others who can report that. So I know we are socially distancing, but let's keep an eye on each other. If you need help, please take advantage of the resources we have, or if you know someone that needs help, please make that call or make sure they have those resources. And with that, I'll turn it over to Commissioner Joe Gale.
Hello everyone, I'm Montgomery County Commissioner Joe Gale. These last several weeks have been extremely challenging to our economy all across the nation, and I've been doing my best to keep the public informed of resources available to them to help them get through these challenging times. Many people are unemployed, many businesses are trying to sustain the flow and be able to reopen when all this is over with. I would like to provide you an update on some job opportunities that are available with life-sustaining businesses. which remain open during this time. For example, there was big news earlier this week that Amazon is looking to hire more employees. In the month of March, they hired about 100,000 new employees, and Amazon hire an additional 75,000 new employees, such as warehouse workers and delivery workers. And many life-sustaining businesses in Pennsylvania are also looking for employees. To this end, the Pennsylvania Department of Labor and Industry has created a COVID-19 job portal website. To qualify for the portal, businesses must meet the criteria, and that is to be a life-sustaining business and have more than 10 job openings available. Life-sustaining businesses can feature their job openings on the portal through an easy-to-use online form. Pennsylvania's looking for work are then able to locate these life-sustaining businesses that are currently hiring using the new online COVID-19 job portal. People seeking employment can access the portal by first visiting pacareerlink.pa. That's pacareerlink.pa.gov. Once on the website, to see active job openings, click the green banner that reads PA COVID-19 Jobs, Hiring Immediately. When you select the Apply Now button for a listed position, applicants will be redirected to the employer's website or email where they can apply directly to the employer to speed up the hiring process. The PA COVID-19 job portal is updated daily, so businesses in the need are spotlighted and people searching for employment have the latest job information. I highly encourage both businesses looking to hire and Pennsylvanians to use this resource. Also today we had a conversation with officials from Pico Energy that asked us to share the following information with the public, and that's that Pico has announced it's extending its assistance for customers impacted by the COVID-19 crisis. There's an extension that's running through June 1st. Pico's support policies include the suspension of service disconnections, waiving new late fees, and reconnecting customers who had previously been disconnected. Customers who are having difficulty paying their energy bill should contact Pico Customer Service at 1-800-494-4000. Again, Pico Customer Service, if you're having difficulty, dial 1-800-494-4000. Pico said it will work with customers to avoid having their service shut off, discuss reconnections, and also determine eligibility for assistance programs for those that are struggling to make their payments due. So we'll continue to keep you updated as more information comes along. And with that, I'll turn it back to Commissioner Arkush.
Thank you. And I just wanted to quickly draw your attention to, I guess would be your left, my right. We have scrolling back here a number of very important phone numbers for child abuse, our community connections, Navigates phone numbers. All these folks are still working, so please don't hesitate to call if you need assistance. And with that, I will take questions.
Anything in the governor's address today stand out to you in particular?
I think it's great to hear that he is so committed to a regional approach and to making sure that we have the data in place and the tools that we need as we open up. You know, I think that he's going to take a very thoughtful process to opening up and make sure that we do it as safely as we can while balancing the obvious economic needs of communities across Pennsylvania. So I look forward to working with him on that plan. And as I've mentioned before, the 5 counties here in southeastern Pennsylvania are all working together to make sure that when we do start to gradually reduce the social distancing that we find ourselves in now, that we do it in concert and we do it in a way that's data-driven and evidence-based.
How challenging is it to get here to the point where hospitals do have available beds, and now you start hearing people say, well, this wasn't as bad as everybody said it was going to be?
So the question is, you know, how challenging is it to get to this point where our hospitals are pretty stable and now have people say, oh, see, it wasn't as bad as we thought it was going to be. So there's an old saying in public health that if public health is working, nothing really happens. And that means that if food inspections are going well, that our food is healthy to eat. If our water sanitation processes are working well, then our water is safe to drink. And this is a similar kind of situation. And in fact, I predicted that this would happen, that if we did what we needed to do, if we shut things down as quickly as we could, and all of you cooperated with that effort and stayed at home, that hopefully, thankfully it appears the case, at least to this point, but I want to emphasize it's not over yet, that we would find ourselves in the position that we're in right now, where we do have hospital beds, and our hospital staffs here in the county are doing okay. And if somebody needs a 911 ambulance ride, there'll be an ambulance to come and get you quickly and efficiently as always. So, you know, it's always that balance. If we get this right, then people will look back and say, what were you so worried about? But what we were so worried about was what happened in Italy, and very sadly, what is still to some degree happening in New York City. I have many, many friends and colleagues in the medical profession in New York City, and what they have been through these last several weeks is something that none of us would ever, ever want to go through. So many individuals have lost their lives in the city due to just really incredibly difficult circumstances, and I am just thankful every day that at least to this point we've been able to avoid that here in Montgomery County.
Just another question. The mask ordinance goes in effect Sunday night?
Sunday at 8, I believe.
Is there going to be any enforcement by the county?
It's the governor's order, so the enforcement kind of roll down from there. So I don't know what's in that order in terms of enforcement. I'm sorry, I didn't read it that closely for the enforcement piece. But generally speaking, the county doesn't necessarily have the ability to enforce a state order. But, you know, we encourage people to do what they've been doing now, which is people have told me that they've gone into crowded grocery stores where there wasn't appropriate social distancing, and they've asked for the manager and complained, or they've just left. You know, I think that people can vote with their feet, and you certainly have an opportunity to patronize businesses that feel safe to you, that feel clean, that feel like they're setting up their checkout and other things in a way that feels safe and protective of both the employee that's checking you out and yourself. And I think that's probably the best enforcement in most cases.
My other question, I guess, was regarding about domestic violence. I don't know if that's Commissioner Horn.
Yeah, sure, Commissioner, let's take that.
Excuse me. I was just wondering, is there any place for victims to go? Is any shelters or anything like that still open?
Absolutely, yes, absolutely, and that's the point. The question was, are there still shelters open? Yes, you can contact the house. There is still assistance for victims. They should not feel that they need to stay at home if they are being abused.
They can openly just go there. Okay, I just want to make sure.
I think, Teresa, anything from outside? Good. Okay, so we will tomorrow and Sunday issue a press release. We won't have any live briefings, so we will see you back here on Monday at 3. Have a good weekend. Thank you.